I do have a question real quick. I'm going to jump in.
Yeah.
Alex, so if we have, as a caregiver, if we have a patient who we see there is some cognitive decline. So, for example,
Mhm.
they're not as organized as they used to be, right? They
Mhm.
might be forgetful, but just the whole lack of organization, lack of structure. We're seeing some of this. How do we convince them to come and see you because they're an adult and we don't have, power of attorney or anything over them?
Mm. Yeah, that's totally fair. And another good point. So I mentioned memory as kind of an example that I used often because it's probably the most common reason that somebody might get referred to a neuropsych is complaints about memory, whether that's actually memory or something else, right? But that's another good example. So in terms of you know. In terms of trying to I guess convince someone that hey this would actually be helpful. Um, I'll say it this way when I see someone for an evaluation, the first thing that we're doing is always a consent, an informed consent. So we're going over kind of the what to expect from this evaluation. We're going over the risk and reward, right? So the risks are it's probably going to fatigue you. It may be stressful. It might make you a little anxious at times. It might be even frustrating at times, but there's nothing invasive. There's, nothing life altering is going to happen in the course of a neuropsych evaluation. And I try to frame it like, because we often do have people come in and are reluctant or suspicious. Uh, and so I might say to that person, look, um, I want you to think of this as part of your medical, part of your medical care. Just in the same way that you would go to a doctor and have your blood drawn to make sure that your levels are all normal. You go to a neuropsychologist to have your brain's uh, level of functioning to be evaluated, so that if there is something that, and there may not be, right? I sort of leave it open-ended, right? There may not be anything wrong at all. We may come back with totally normal results. That would be amazing news. But if not, if we do identify some kind of weakness, then this will help us know what to do about it. And we don't necessarily give you we don't necessarily give you a pill or anything to address any of those weaknesses. But this might help us figure out, well, what are the strategies that we can use? How can we compensate for any of those weaknesses? So kind of framing it in a, this doesn't have to be a scary kind of thing. A lot of times people go into it thinking, they hear the psychologist part of the word and think, oh man, if this person thinks I'm crazy, I'm going to get committed, right? I hear that all the time. We're not in the business of doing that, right? There's with a little caveat, there are very strict and very few scenarios where that actually may come up. But for 99.999% of folks that we're seeing as an outpatient, we're just part of the medical team, and we want to help you understand how your brain is working, um, so that you can do things to make your brain work even better for you. That's kind of maybe how I would say it.